There is one organ which causes high blood pressure, and it's not what you think. And there are specific exercises you can use to target and fix your blood pressure easily. No diet, lifestyle changes, or medication required. Check the link in the description below, but for now, today's question.
The question, can blood pressure be categorized as high, medium, normal, and low? In addition to the excellent Emmanuel Fabella's answer, just some observation on a too low blood pressure. We only consider blood pressure too low if the person having it complains of dizziness, feeling faint, have collapses or near collapse. Otherwise, if people are happily walking about with a blood pressure of 105/70ths of a millimeter Hg, we wouldn't categorize it to be too low. In Germany they prescribe meds against these asymptomatic instances. In the Netherlands we don't, since it has never been proven to do any good. However, when treating high blood pressure we shouldn't lower the diastolic blood pressure to less than 70 millimeters Hg, since there are papers that report an elevated risk of dying when the diastolic blood pressure was lowered to less than 70 millimeters Hg, especially in people with coronary heart disease. This latest 2013 paper reported higher all-cause mortality in 14,270 US VA patients 45 to 85 years whose blood pressure had been recorded at least once, so not focused on heart patients. Low diastolic blood pressure is a risk for all-cause mortality in VA patients. This 2007 paper, Diastolic Blood Pressure and Mortality in the Elderly with Cardiovascular Disease, shows a higher all-cause, left panel, and cardiovascular, right panel, mortality in 331 French geriatric, age greater than 70 years, heart patients whose diastolic blood pressure was lower than 70 millimeters Hg, many of which were on antihypertensive meds. So maybe a diastolic blood pressure under the 70 millimeters Hg could be considered too low and should be avoided when treating too high a blood pressure. Other blood pressure values lower than 120/80ths of a millimeter Hg, in practice 140/90ths of a millimeter Hg, and a diastolic blood pressure not lower than 70 millimeters Hg one should consider as normal. I hope that helps. If you need more answers and advice on hypertension, I've included some links in the description.